You might have been bitten by a tick, which is a small arachnid that looks like this. Ticks feed on the blood of mammals, birds, and sometimes reptiles and amphibians. They're often found in wooded or grassy areas, and they can transmit diseases such as Lyme disease, Rocky Mountain spotted fever, plus others through their bite. In this video, I'm going to help you learn what to do after you've been bitten by a tick, and also how to safely remove and dispose of it, plus when you should consider seeing your doctor. So if you've been bitten by a tick, it's really important that you remove it straight away. For this, you're going to need a pair of tweezers or a special tick removal device, as well as some alcohol gel, or if you don't have this, some warm water and soap. In this video, we're going to cover how to remove a tick using tweezers. But if you decide to use the special tick removing device, simply follow the instructions that come with the packet. And again, each one of these will be slightly different. So first of all, step 1. Use clean, fine-tipped tweezers to grasp the tick as close to the skin surface as possible. Once you've done this, move on to step 2. This is pulling upwards with a steady and even pressure. Don't twist or jerk the tick, because this can cause the mouth parts of the tick to break off and remain in the skin. Now, if you can't remove the mouth easily with the tweezers, leave it alone and try to seek an opinion from a medical provider. Often it will be just advised to leave it alone and let the skin heal, but again, it's worth seeking a second opinion. So step 3. After removing the tick, thoroughly clean the bite area and your hands with rubbing alcohol or soap and water. Step 4. Dispose of a live tick by putting it in alcohol, placing it in a sealed bag container, wrapping it tightly in tape, or flushing it down the toilet. Remember, it's really important never to crush a tick with your fingers, and also remember that your goal is to remove the tick as quickly as possible, not waiting for it to detach. Now, some people who've removed a tick sometimes wonder if they should have it tested for evidence of infection. Now, although some commercial groups offer testing, in general, the CDC suggests that this is not recommended because of potential issues around quality control, inaccurate testing, and normally if you have been infected from the tick bite, you'll probably develop symptoms before the results of the tick test are available. Now, if you do become ill, you shouldn't wait for tick testing results before beginning appropriate treatment. And in this case, it's really important to speak to your health provider. In terms of when you should see a doctor after being bitten by a tick, well, in general, you should see a doctor if you develop a rash or fever within several weeks of removing a tick. When you see your doctor, remember to tell them about your recent tick bite, including the location you were bitten and where the tick bit you, as well as when the bite occurred. Finally, I'd like to make you aware of a really useful resource available for free on the CDC website, which is called the Tick Bite Bot. This is an interactive tool that will assist you on removing attached ticks and determining when to seek healthcare if appropriate after a tick bite. I've included a link to this in the description box of the video, plus lots of other useful resources for you to review in your own time.